Assalamu alaikum dear students. Welcome back to my YouTube channel. Today we will discuss most important MLT MCQs part 1b. Gram negative bacteria stain. Option A purple, B pink or red, option C green, and option D yellow. So the correct option is B, pink or red color. Gram negative bacteria seen pink or red color. Explanation is gram negative bacteria lose crystal violet and take up safranin, which is red or pink color, appearing like pink or red color. Glucose oxidase method is used for estimating option A urea, B glucose, C cholesterol, and option D creatinine. So the correct option is B glucose. Explanation: glucose oxidase specifically reacts with glucose, producing measurable products. Subscribe now and press the bell icon. Never miss an update from early technologist. ESR erythrocyte sedimentation rate is increased in option A polycythemia, option B anemia, C dehydration, and option D congestive heart failure. So the correct option is B anemia. ESR raises in anemia, which is due to infections and inflammatory conditions. The causative agent of syphilis is option A bacterium, B virus, C fungus, and option D protozoa. So the correct option is A bacterium. Explanation: Treponema pallidum is a spirochete bacterium which causes syphilis. The normal range of serum potassium is option A 2.5 to 3.0 milliequivalent per liter, B 3.5 to 5 milliequivalent per liter, C 5.5 to 6.5 milliequivalent per liter, and option D 6.5 to 7.5 milliequivalent per liter. So the correct option is B 3.5 to 5.0 milliequivalent per liter. Explanation: normal potassium range is 3.5 to 5.0 milliequivalent per liter, crucial for muscle and cardiac function. Gram negative bacteria stain option A purple, B pink or red, C green, and option D yellow. So the correct option is B pink or red color. Gram negative bacteria lose crystal violet stain and take up safranin, appearing pink or red color. Anti-streptolysin O ASO test is used to detect option A recent streptococcal infection, B tuberculosis, C malaria, and option D typhoid fever. So the correct option is A recent streptococcal infection. Explanation: the ASO titer is after streptococcal infections useful in diagnosing rheumatic fever. Dear student, this is so important MCQs. A blood smear is best prepared from option A venous blood, B arterial blood, C capillary blood, and option D plasma. So the correct option is C capillary blood. Finger prick is capillary blood is the ideal for making peripheral blood smear. The most common fixative for cytology smear is option A 95% alcohol, B 10% formalin, C acetone, option D Bowen's fluid. So the correct option is A 95% alcohol. Alcohol fixation preserves cellular details for cytology slides like pap smear. Mantox test is used to detect option A HIV, B tuberculosis, C hepatitis B, and option D syphilis. So the correct option is B tuberculosis. Explanation is Mantox test measure delayed hypersensitivity to tuberculin, indicating TB exposure. The normal range for total leukocyte count is option A 2000 to 4000 per cubic millimeter, B 4000 to 11000 per cubic millimeter, C 11000 to 20000 per cubic millimeter, and option D 20,000 to 30,000 per cubic millimeter. So the correct option is B 4,000 to 11,000 per cubic millimeter. Explanation is normal WBC count is between 4,000 to 11,000 per cubic millimeter of blood. This is so important MCQs. The anticoagulant in EDTA tube is option A sodium citrate, B potassium oxalate, C ethylene diamine tetraacetic acid, and option D heparin. So the correct option is C ethylene diamine tetraacetic acid. EDTA bind calcium to prevent blood clotting, mainly used for CBC tests. Blood grouping is an example of option A precipitation reaction, B agglutination reaction, C neutralization or reaction, and option D complement fixation. So the correct option is B agglutination reaction. Explanation: blood grouping involves antigen and antibody mediated agglutination of red blood cells. This is very important MCQs. The main storage form of iron in the body is option A ferritin, B hemoglobin, C myoglobin, and option D transferrin. So the correct option is A ferritin. Explanation is ferritin stores iron intracellularly and releases it when needed. Benzone protein is associated with option A typhoid, B diabetes, C multiple myeloma, and option D hemophilia. So the correct option is C multiple myeloma. Benzone protein, basically light chains, are found in urine of multiple myeloma patients. Which of the following is a gram-positive cocci? Option A E. coli, B Pseudomonas aeruginosa, C Staphylococcus aureus, and option D Klebsiella pneumoniae. So the correct option is C Staphylococcus aureus. Staph aureus is gram-positive and arranged in cluster form. Reticulocyte count is used to assess option A platelet function, B bone marrow activity, C leukocyte count, and option D ESR. So the correct option is B bone marrow activity. Reticulocytes are immature RBCs indicating bone marrow response to anemia. Coombs test is done for option A typhoid diagnosis, B detecting hemolytic anemia, C. Malaria diagnosis, and option D. Leukemia detection. So the correct option is B. Detecting hemolytic anemia. Explanation is Coombs test detects antibodies attached to the red blood cells in autoimmune hemolytic anemia. This is so important MCQs. ZN stain is used for option A. Fungi, B. Acid fast bacilli AFB, option C. gram positive cocci, and option D. Spirochetes. So the correct option is B. AFB bacilli. ZN stain is specific for Mycobacterium tuberculosis species such as TB bacilli. Which test is most used to detect hepatitis B surface antigen? Option A. VDRL, B. HBS AG ELISA, C. Vidal, and option D. ASO titer. So the correct option is B. HBS AG by ELISA test. HBS AG is detected by ELISA to screen for hepatitis B infection. So this is very important MCQs. The stain used in bone marrow smear is option A. Gram stain, B. Zn stain, Zn stain, C. Leishman or James stain, and option D. Safranin stain. So the correct option is C. Leishman or James stain. Explanation is these Romanovsky stains are used to differentiate bone marrow cells. The preferred specimen for CSF cerebrospinal fluid examination is collected by option A. Vein puncture, B. Lumbar puncture, C. Finger prick, and option D. Bone marrow aspiration. So the correct option is B. Lumbar puncture. CSF is collected from the lumbar spine for diagnosing infections and other CNS central nervous system disorders. The pH indicator in McConkey-Agar is option A. Phenol red, B. Methyl red, C. Neutral red, and option D. Bromothiamol blue. So the correct option is C. Neutral red. Explanation is neutral red changes color based on lactose fermentation by bacteria. Clostridium tetani causes option A. Typhoid, B. Cholera, C. Tetanus, and option D. Diphtheria. So the correct option is C. Tetanus. Clostridium tetani produces a neurotoxin leading to muscle spasm. Normal urine output per day in adults is option A. 100 to 300 ml, B. 400 to 600 ml, C. 800 to 2000 ml, and option D. 3000 to 4000 ml. So the correct option is C. 800 to 2000 ml. Normal urine output ranges between 0.8 to 2 liters per day in adults. VDRL test is used to detect option A. Typhoid, B. Tuberculosis, C. Syphilis, and option D. Hepatitis B. Option C. Syphilis is correct answer. VDRL is a non-treponemal test which is used to detect antibodies in syphilis. Hyperglycemia means option A. Low blood sugar, B. High blood sugar, C. Low blood pressure, option D. High blood pressure. So the correct option is B. high blood pressure. Hypoglycemia refers to elevated glucose level in the bloodstream. If you like this video, please सब्सक्राइब माई यूट्यूब चैनल। अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे यूट्यूब चैनल को सब्सक्राइब ज़रूर करें। Dear students, the hemoglobin estimation is commonly done by option A, Jeffries method, B, Salis method, C, Biuret method. So the correct option is B, Salis method. Salis method, Salis acid hematine method is used for classic technique for hemoglobin estimation. Leptospira is best seen using option A, gram stain, B, dark field microscopy, C, India ink, and option D, Zidane stain. So the correct option is B, dark field microscopy. Explanation is Leptospira are thin spirochetes which is visualized by dark field illumination. Thank you for watching my videos.